Hello, everyone. Welcome back. We're going to be taking a look at coding procedures for the neurological system in Chapter 9. Okay, it's helpful to think of the codes or the PCS coding of procedures as falling into two buckets, if you will. These are procedures that are either on the central nervous system, which is in tables 001 through 00X, or procedures on the peripheral nervous system. Let's take a quick look at the tables in 001. Okay, so you can see here 001 through 00X as advertised, right? And so we get into the third character. These are getting into the operations, the root operations, the bypass, the change, or destroying like a benign growth, dilation, division, drainage, excision, extirpation, extraction, fragmentation, and insertion. So if you think about some of these things, when you look them up and say things like deep brain stimulation, what root operation would this fall under? That's the question you have to ask yourself. You're in the right table. Now it's just a matter of finding out exactly what that root operation is. This is where the appendixes may be very, very helpful to you. So you can see moving on past the root operations, if you will, we have the body part. And of course, we know that the body parts that are listed in the central nervous system is anything relating to the brain and the spinal column. So we see such things like the brain, of course, but we also see the meninges, the dura, the epidural space, the subdural space, the cerebral ventricle, the pons, the cerebellum, and all these other things that you've heard about in your earlier classes. This is where knowledge of medical terms and some anatomy and physiology comes in. Then we have the approach. And again, this is something that's outlined in appendixes, but if you think about it, it makes sense. You could do things either through an open procedure where you're opening it up the skin and whatever else to get at the surgical site in the central nervous system. This could be percutaneous. This could be percutaneous endoscopic, or external, where we're doing an actual operation and cutting onto the skin, if you will. Then we can have devices, and these could be things like a radioactive element, a monitoring device, infusion, a drain, and so on. And then we have the qualifier, right? Some of these things go through blood vessels, what have you. All these qualifiers gives us a different level of detail on this. So again, we see our root operations, all these things that we can do to the central nervous system to treat the patient. And the character for it talks about the specific body type. This is outlined in table 9.2, right? And the approach, we've covered that. But of course, we get into the last two characters, 6 and 7. 6 identifies the device, could be a drain, could be a tissue substitute, could be a neurostimulator lead, whatever it is. And then we get into the qualifiers. Qualifiers, of course, give us different level of details in terms of the procedure. So in this case, we want to know whether it's diagnostic or Z for no qualifier. Now we get into the peripheral nervous system. This starts in table 012 and goes through table 01X. And we see a lot of the same root operations, right? But before we get involved in that, let's take a look at that table. And again, here, the first three characters, of course, is the table, right? So here, in this case, we're looking at table 012. And then starting with the third character, we're getting into the root operation. In other words, what are we doing? We're changing something, we're destroying something, dividing something, draining something out of the peripheral nerve, excision, extraction, all these different things, repairing, right? And then the body part is the specific location of where the procedure is happening, the ulnar nerve, the cervical nerve, and so on. And then the approach again is going to be the same four approaches: open, percutaneous, percutaneous endoscopic, external, and those are our choices for character 5. Character 6, of course, we're getting into the specifics, right? In other words, with the device, what type of device is it? Is it a drainage device? Is it a radioactive element? Is it something that monitors something, right? Is it a neurostimulator lead? Whatever it is. And then the qualifier is giving us another different level of detail, right? It could either be diagnostic or no qualifier, or it could get into specifics about the lumbar nerve, the femoral nerve, and so on. Okay, we talked about our root operations. Again, good place to put a post-it note or something on the appendix so you know exactly what these things are. It's easy to get confused with some of these things. What's an excision? What's an extraction? And again, the approaches, again, something else that's also very nicely laid out in the appendixes, also in your text. And character 6 is the device. Sometimes if you're seeing a device that you're not really clear on what it is, it's useful to say go to Mayo Clinic and take a look at what it is, right? That's always helpful. And then lastly, to determine if there's no qualifier or if this is something that's being done for diagnostic purposes only. And that's all I have for you. Please stop by if you have any questions about any of this material. We'll see you online. Bye now.